Welcome back, guys. This is video number 2, so video B. If you are keeping track, we are going to continue on. We just finished with the second impact syndrome. We're going to move in, still working with the brain, but we're going to continue to move on. We're going to move to the cerebral contusion. Contusion meaning a blow or bump, and the cerebral is the brain. It is a focal injury to the brain that involves small hemorrhaging, any kind of bleeding on the brain, cortex, stem, or cerebellum, and usually occurs after a head strike by a stationary object. Signs and symptoms that occur, you need to know the actual injury because there's levels of severity, but it will likely experience a lack of consciousness or loss of consciousness, followed by a very talkative state where they come back. Normal neurological exam, headaches, dizziness, and nausea. Take them to the hospital, get a CAT scan, MRI, etc. Treat according to the status of the patient, and obviously when you return them to play, they need to be asymptomatic. Meaning no symptoms, and their CAT scan is normal. The CT scan is normal. Malignant brain edema syndrome. Malignant meaning it is growing, it's aggressive, but an edema is blood on the brain. So occurs in young populations within minutes to hours of a head injury. It's caused by intracranial clots, resulting in diffusion of brain swelling with little or no brain injury. And the swelling is a result of a hyperemia or a vascular engorgement. And it is usually based on the pressure that is expanding on the brain and within the skull. And you can see it obviously in a CT scan, but you would be able to see it sometimes if it's pushing on the skull itself. Rapid neurological deterioration, so they can go into a coma quickly and they can die. Management, make sure it's a life-threatening condition, make sure they get to the hospital or emergency care facility as soon as possible. Epidural hematoma. Epidural hematoma. There's going to be a few hematomas and we're going to talk about them, but epidural is the first one. It is a blow to a head or a skull which tears the meningeal arteries. Blood pressure, blood accumulation, and creation of hematoma occur rapidly within minutes to hours. Loss of consciousness, rapid lucidity, few signs and symptoms of serious head injury, gradual progression of signs and symptoms occur, but you have to note there is head pains, dizziness, nausea, dilation of just one pupil, same side as the injury, deterioration of consciousness, rigidity of the neck, depression in pulse and respiration, and can occur in convulsions. Require urgent neurological care. Neurosurgical care. Get them to the emergency room as soon as possible. You need to relieve the pressure of the hematoma, blood clot, blood on the brain, to avoid disability or death to the patient. Subdural hematoma. Sub, we know, means under. It is a result of acceleration or deceleration of forces that tear vessels and bridge the dura mater and brain. May be acute, could be real fast, that rapidly progressing in association with brain skull or injury, could be chronic, and it could be a vein that's bleeding slowly, and it can lead to some serious pressure in the brain. Intracranial, meaning within the brain or inside the brain. Signs and symptoms. Simple subdural hematoma, usually loss of consciousness, generally does not occur. And here is, let me finish signs and symptoms and then I'll show you the visual. But signs and symptoms, complicated subdural hematoma, loss, so simple versus complicated. Complicated, now you can have loss of consciousness, dilations of the pupils, dizziness, headache, nausea, sleepiness. Management, immediate medication, or not medication, medical attention is needed, so get them to the emergency room. You need your CT scan, MRI, determine the extent of the injury. Right here, and this is how I remember, this is an epidural hematoma versus a subdural hematoma. Epi, it is starting to peel off the skull, so it is pulling off the skull, and you can see it right here where it's got its own little pocket. This blue is pulling off the skull, so it's pushing between the two. Where the subdural is under, it's still attached to the skull itself, so it is underneath the skull, and that I do my still attached, where I've got my S's and then my peel off the skull. So that's how I tell the two of them apart. But they are pockets of blood that occur on the brain. Migraines. I don't know how many of you suffer from migraines. If I don't have my caffeine, I get migraine headaches, and that is a muscular, and it's going to talk about that here in a second. Situation, disorder characterized by recurrent attacks of severe headaches seen in those who have repeated head trauma. I do not have head trauma that I'm aware of. Its exact cause is unknown, but it's believed to be vascular, and that is where mine usually falls. Triggers include food, medication, sensory stimuli, lights, odors, etc., lifestyle changes, changes in estrogen levels. The food for me is the caffeine, and that's not always a good thing. I need to remove the caffeine from my diet. Sudden onset with possible visual or gastrointestinal problems, migraines, flashes of light, blindness, half-field vision, paresthesia, throbbing pain, that's usually mine, where my head is just throbbing. Sensitivity to light, sounds, or smell, typically that's get it in a dark room. It helps relieve the pain. And you experience tingling sensations, numbness in the arms or legs, or even dizziness. You can prevent. So try and, if I know caffeine's my trigger, maybe I have my cup of coffee in the morning and then I go on my merry way, but don't over caffeine, because that's when my body really craves it and needs it, and that's when I start to have those migraine headaches. Prescription medications can have high success. Scalp injuries. Blunt trauma, penetrating trauma tends to be the cause to the scalp. Can occur in conjunction with serious head trauma if it happens. Signs and symptoms. Patient is complaining of a blow to a head. Bleeding is often extensive and sometimes difficult to find, especially if it's within the brain. You need to clean it with soap and water, so your antiseptic, soap and water. Get the debris out of there. If it's a little kid who falls off of a bike, get the stones out of there. Cut away the hair if necessary to expose the area. Apply that pressure. Use the astringent to continue to clean and reduce the bleeding. Wounds larger than a ½ inch depth should be referred, because they're probably going to need stitches. Smaller wounds can be covered with protective covering and gauze, and use an extra adherent just because you've got the fluid, the liquid of the blood, and it can make the bandage or gauze not adhere. Now we're moving in. You're going to get more visual pictures. I'm giving you that warning. So if you are not, if you're hypersensitive to these pictures, just a heads up, and you can cover your screen. First, showing you right now the jawbone, and we're looking at the mandible. The mandible is that jawbone area. These are the muscles and ligaments we're going to talk about right here, and we're going to begin with a fracture, and you can see the fracture hairline. It's a hairline fracture right here, but it is a fracture of the mandible, lower mandible. Direct blow generally fractures at the frontal angle, so it's coming in. You're getting punched here, here, here. It can occur in a sport if someone gets underneath your helmet. It can occur in hockey very easily. Deformity, loss of occlusion, pain with biting, bleeding around the teeth, lower lip, anesthesia. It's numbness. Temporary immobilization with elastic wrap followed by reduction and fixation. What about when that mandible gets dislocated? So when we talk about it's moved into a different direction, so the mandible is dislocated, it involves the TMJ joint. Mechanism of injury is generally a blow to an open mouth from the side. Dislocated jaw represents in locked jaw open position, typically with poor range of motion and poor occlusion. Management, cold, reduce the movement if you can, because it's going to get really sore. Follow with a soft diet and anti-inflammatory drugs, analgesics, any kind of things that can help them return to normal feeling in their mouth. 7 to 10 days. Can be recurrent and can become TMJ dysfunction. Temporomandibular joint dysfunction, and that is your TMJ, your tempo, meaning of the temple, mandible, right here, the M, and then the J. So TMJ dysfunction. I have that personally, and my jaw will lock if it's, if I take a hit, like if I run into somebody's shoulder with my jaw can lock open, and that's not a good feeling. I actually wear a hard plastic mouthpiece to keep my jaw from locking at night, because why I have it is because I grind my teeth at night really hard, and it's not a comfortable feeling to wake up with locked jaw. Disc condyle derangement. Discs are positioned anteriorly. Headaches, earaches, vertigo, inflammation, neck pain, muscle guarding and trigger points. Hyper or hypomobility, so muscles either really lax or they're very tight. Limited range of motion, clicking and popping. My most noticeable right here is the clicking and popping. Treat with custom design removable mouthpiece, which I have. Treat problem with either strengthening or stretching, and if corrective measures fail, refer to a dentist or an orthodontist could be necessary. Zygomatic complex, which is your cheekbone. There's a fracture that has occurred right here, and you see one of his symptoms is the black eye slash bleeding on the eyeball itself, but the fracture has occurred here. You see a little bit of swelling. Mechanism of injury, direct blow. Easy enough. Deformity, bony discrepancy, nosebleed, diplopia, and numbness in the cheek. Management, cold application to control the edema, so the internal bleeding. Immediate referral to physician. Healing will take 6 to 8 weeks, and proper protective gear will be required upon return to play. Softball players can take one of these, and baseball players, but with softball being so close to the field, if a base player or a pitcher for that gets a line drive to the face, it can fracture that cheekbone. That can occur, and then they wear the plastic guard on their face when they pitch. Maxillary, that is the upper, your maxillary bone right here. That is the upper jaw, upper lip, so right above your top teeth. Upper blow to the jaw. Pain with chewing, nosebleed, double vision, numbness in cheek region. Severe bleeding can disturb breathing. So you need to make sure if there is that severe bleeding, you need to make sure that they stabilize the airway. You need to check for any possible brain injury where you have maybe shaken your brain if you've gotten punched or hit hard enough. Take them to the hospital. Keep them upright, forward, and conscious. Fracture reduction, fixation, and mobilization will occur when they're at the hospital. Facial lacerations. This is probably the nicest picture I could find because these are brutal looking if you want to go crazy and look them up. But result of a direct impact, indirect compressive force, or contact with a sharp object. Signs and symptoms, substantial bleeding, pain. Apply pressure to control the bleeding. If it's small, you need to get them to the hospital, especially for stitches.